conversation. I'd like to welcome everyone to our Carillon Conversation series. I'm Dr. Alonso Martin. I'm a functional medicine doctor here at the Carillon. And I want to start by saying thank you for everyone that's joining us. And for everyone that's watching at home, thank you for being at home, for staying safe. And just like you guys, I'm in my living room broadcasting live to you. So thank you so much. I'm just going to make sure here that we're ready to go. And so without further ado, we will get started. Today's conversation is about gut health, and it's intended as an introduction because gut health is such a huge topic, and there's so much research going on about the microbiome and about our gut and intestinal health that today will just be an introduction. Although I will be presenting a lot of information to you, a lot of helpful information. Today is intended more as an introduction and a short briefing introduction. So we'll get started. Thank you everyone for attending. So these are our objectives for today. These are our conversation objectives. We'll be discussing intestinal health and dysfunction. So what happens when you have good health and what happens when you have bad intestinal health. We'll also be looking at the signs of poor digestion. So a lot of people can relate to these signs because they're experiencing them, and they know people that are having problems with digestion or overall metabolism. We'll also be looking at the cleansing with the 4R restoration program that I use with my patients. We'll dive deep into that topic. It's a very invigorating topic, lots of information there. And then towards the end, we'll discuss nutrients for gut health, both in food-based and also in supplements and supplement-based. And I think you'll find it very enjoyable and very helpful. So why are we talking about all of this to begin with? Why the gut? Why are we paying so much attention? Why are we dedicating so much time to talking about the gut? Something that seems so boring, so secondary, so something that seems that's in the background. Well, the gut is actually one of the most important systems in the body. It consists of a complex biologic system known as the microbiome that consists of fungi, viruses, archaea, and bacteria. So all of these are microorganisms that exist right in your abdomen, right in your gut. It's a very delicate biologic system. So it's very important to know that as we start to learn more about the gut in this introduction. And just in bacteria alone, there's 39 trillion bacteria cells. That's right, 39 trillion bacteria cells, both on the outside of your body and inside of your body combined. That's a lot of cells. So gives you more of a reason to really learn more about this. And all of that bacteria combined together weighs about 3 pounds, which is about the weight of your brain. 3 pounds in its entirety. So very important ecosystem. And we know that food influences the power of the microbiome. There's a lot of power behind this environment that lives in your gut. So food is a strong influencer in how it behaves. We know that some of the bacteria in the gut has powerful signaling mechanisms that affects our mood, our sleep, our behavior, how we react to our daily stimulus and our daily environment. So food in itself, eating food, things that we do every single day, multiple times a day, really has a huge impact on the microbiome. And we'll learn more about which foods in particular can support and nourish the microbiome later in this conversation. And we know that the bacteria that exists in our body, when it digests plant-based fibers, so when we eat plants such as broccoli, spinach, kale, when it digests these fibers that exist in these plants, it makes short-chain fatty acids known as propionates, butyrates, and acetates. And so what are these short-chain fatty acids? Why do our bacteria make these fatty acids? Well, these fatty acids are actually very beneficial for our health. They help lower our cholesterol. They help reduce inflammation. They protect against plaque formation in our arteries, which is very important. And they improve our digestive health in general. So when we eat plants and vegetables, the bacteria that exist in our gut actually processes those plants and digests those plants to make these very beneficial substrates that then get absorbed into our blood, into our body, and help us with our chronic illnesses, such as cholesterol, inflammation, plaque formation, atherosclerosis. So very, very important. We can connect. Now we're starting to connect the things that we eat with our gut and microbiome. And lastly, the microbiome is such an amazing environment, biologic system that it's highly researched internationally and around the globe. Publications have come out and are continue to come out about everything that we're discovering about this microbiome that exists in our body. So quite fascinating. So what is intestinal health? What does it mean for us to have good intestinal health when we're healthy? So we know that our GI system gets the largest blood supply from any other organ in the body. So it absorbs about 1/3 of the blood that the heart pumps out to the body. So 1/3 of that blood goes directly to our intestines and our gut. So it really has a huge role in our body if it's needing that much blood. And the transit time, meaning the time that it takes from you eating something from your mouth through your GI system and down to your rectum for it to be excreted, should be about 24 to 30 hours. However, in America, in the US, it's more like 48 hours. There's different reasons why that might be the case. For starters, we eat a lot of processed foods in America. Our Western diet is full of fillers, full of processed foods, fast foods, things that don't really help our digestion move along, things that actually slow our digestion and cause all of this food to sit in our intestines and in our gut longer than it should. So that's a big reason, and that's something we measure. That's a health measure to know whether our intestinal health is good or not. And then something that's even more important is that a huge part of our immune system. So our immune system is one of the systems in our body that helps fight infections like viruses, pathogenic bacteria, yeast, things that make you really sick. 80% of those little immune lymph nodes actually surround the gut. So more than the majority of lymph nodes that exist in the body are completely around the gut. So that is so important to know. It's so important to know that connection exists between the immune system and our gut. And that connection is so vital. And a lot of scientists, a lot of physicians, the medical society believes that the connection between the immune system and the GI may be the root cause for a lot of our chronic illnesses. And we'll touch more upon that in the slides to come. And so we know that Peyer's patch is that strip of immune tissue that's in the gut, and it's considered a gut-associated lymphoid tissue. So that's the technical term. That's a proper term for that component of the immune system. And since everyone wants to know more about their metabolism and how to lose weight and how to gain more fitness and live longer, we know that the gut and your metabolism are intrinsically connected. So anything that's going on in the gut will affect your metabolism and influence your metabolism. And we know that the microbiome, that delicate ecosystem of all those organisms, are actually more metabolically active than the liver itself. And the liver is known as the metabolizer, the detox organ in the body. But the microbiome is actually more metabolically active than the liver. So next, what does intestinal dysfunction look like? I hear from patients all the time that they're just not feeling well. They're having poor digestion. They're having bloating. Lots and lots of symptoms and signs. So how do we get to a place where our intestines are properly functioning? And it goes down to an imbalance of gut bacteria is disrupting this ecosystem. So there's really this gut bacteria is not balanced, meaning there's more pathogenic and less beneficial bacteria. There's an imbalance there, so that can contribute to intestinal dysfunction. And this dysfunction is linked to diabetes, autism, IBD, infectious colitis, IBS, cancer, asthma, psoriasis, MS, Parkinson's, Alzheimer's disease. Really, the list goes on and on. And being low in vitamin B's, such as B complex, B6, B5, B12, can promote poor digestion and metabolism, and that will lead to dysfunctional microbiome. And we also know that drinking in excess, so drinking excessive amounts of alcohol, can put a stress on the microbiome and on your GI system, and it can influence its ability to digest food. So be very careful with the amounts of alcohol that you're drinking, especially now when you're home. You have less options to go out and socialize and engage with your friends. So just be very mindful that we're at home now. We have more access to alcoholic beverages, and really be mindful of your gut when you're drinking. We know that the gut is also strongly influenced by emotional trauma. The gut has its own nervous system, just like our brain and our spinal cord. Well, the gut has its own nervous system called the enteric nervous system. Some people call it the second brain of the body, because it's so equipped with nerves, with nerve bundles, with neurons, that the gut itself has its own system of relaying messages through neural connections. And so any kind of emotional trauma or any emotional disruption, your gut is the first place to feel it. And so oftentimes patients tell me, whenever I get anxious, I start to have diarrhea, or I start to have abdominal pain. And we know that that anxiety is felt primarily and most often when we have gut issues. So there is the connection there. And we also know that about half of the adults in the US will experience intestinal illness at some point in their life. So about half of us will have issues with our gut. So it's important for us to be able to identify those and know what to do when that happens. And so these are some of the signs of poor digestion that I hear from patients all the time. So you may be able to relate to some of these things, or some of your family members or friends that have digestive issues, such as these. Many times people struggle with weight management. So weight gain is a big sign of poor digestion. Also burping, passing gas, feeling bloated after you eat is really a strong indicator that there might be something going awry with your gut. And also any kind of inflammatory bowel disease like IBS, IBD, that really is an indicator that you have poor digestion. And then any sort of food intolerance, any food allergies also leads back to poor digestion. Overeating, if you find yourself that you're overeating, there may be something going on with your GI and your microbiome. And also ulcers, acid reflux, chronically coated tongue. So if you find that your tongue is just coated with a white film constantly over and over, then also may be a sign that you have poor digestion and something may be going on with your gut. And then I won't go through the list, but less than one bowel movement per day, undigested food and stool, feeling better if you don't eat. So these are all signs of poor digestion. And you'll have access to these slides after the presentation, so you can kind of go through them, digest all of this, and learn more about it. Just feel more equipped with all of this information. So what do we do when we know we have issues with our gut? What is there a program? Do we fast? Do we start new medications? Do we detox? Well, this is the program that I do with my patient. It's called the 4R Gut Restoration Program. And it starts with removing, it continues with replacing, repopulating, and then repairing. So we'll go through each one of those. Removing, we want to make sure that we remove any pathogenic organisms that maybe are affecting our gut, such as pro-inflammatory bacteria that shouldn't exist in the body, or even candida, yeast overgrowth, these pathogenic organisms that are there for whatever reason. There's even been patients that have had parasites and amoebas in their intestines. And so you want to make sure that you identify any pathogenic organisms in your gut and remove those. And then also find the source of the imbalance. Find out whether there's more pro-inflammatory versus probiotic or beneficial bacteria in your body. And testing can help shed light on that. And then also, if you've already done that and you're continuing to have digestive issues, you may be allergic to some sort of food. So identifying what foods you have allergies to or intolerances to is also very, very helpful. So following the removal of all of those offending agents, we start to replace. So we've removed the negative things, and now we want to start to replace any insufficiencies or deficiencies that our body may have, such as hydrochloric acid. Hydrochloric acid is made actually in the stomach, and it helps in the digestion process. So oftentimes patients have low amounts of hydrochloric acid because they're either on acid suppressors, such as medications that lower their amount of acid because they have ulcers or they have acid reflux. But that's just a Band-Aid. You want to really make sure that you're assessing the gut in its entirety, really diving deep and looking at the root cause. What's actually causing your symptoms? Why are you having this acid reflux? Why did you develop an ulcer? So oftentimes we do have to replace hydrochloric acid, and patients start to feel better. Other issues that come up with replacing is digestive enzymes. Oftentimes patients don't have enough digestive enzymes to process their foods, their fats, their carbs, and they have poor digestion and develop diarrhea, bloating, and even undigested food in their stool. So this is a big problem. So many times we offer patients digestive enzymes as a replacement, and they do very, very well. And then some practitioners also offer herbal support just to help nourish the gut, support the gut during this process. And moving on, we want to help repopulate the gut. We want to help introduce the beneficial bacteria that our gut needs in order to maintain this delicate ecosystem. So oftentimes we've been on antibiotics, we've been sick, and so we kill off all that good bacteria, and that bacteria needs to repopulate, needs to reestablish its presence in our gut. So certain bacteria are very important, such as lactobacilli, bifidobacteria, Saccharomyces, if you've been using antibiotics. So these are typically found in probiotics. And so we want to repopulate the gut with that beneficial bacteria. And lastly, we want to make sure we're repairing the gut. We put so much stress and so much stress, digestive stress on the gut that oftentimes the microvilli, which are the little fingers that exist in the intestinal cells that help with absorption and processing and moving the food along, those oftentimes are blunted or damaged. So we want to make sure we're giving our body, our gut, the proper nutrients and the proper tools for it to repair. And some of the things I use with my patients, and I actually use them myself, are L-glutamine. L-glutamine is an amino acid that helps nourish the microvilli, helps repair our intestinal lining. Also glucosamine, very, very soothing for our gut. And it helps alleviate a lot of the inflammation and a lot of the digestive issues in our small intestine. And then moving forward into our large intestine, the large colon, we recommend, and I recommend, fiber to patients, and butyrate, which is one of those short chain fatty acids that comes from plants. We often use those to help patients restore and repair their gut. And then things like caprylic acid, which is a natural fatty acid. It's a natural fatty acid in coconuts. Very, very helpful, very, very soothing for the gut, as well as licorice, quercetin, and aloe. Aloe is extremely soothing for the gut. It nourishes the villi, the tight junctions, which are the little spaces between the intestinal lining. And so Oftentimes, this is a comprehensive program that we offer patients with all 4 components. And fasting, we know that fasting is a wonderful way to help restore our body, not just our gut, but our body as a whole entity. Fasting actually allows your body to create new stem cells from your own bank of stem cells. So this is something that we can definitely discuss more if you're interested. But the body does regenerate itself when you fast, even for periods of 12 to 16 hours. So very, very important. And so, what is the first step? If you're relating to some list, how do we start with this restoration process? Well, the first step is actually testing. We want to make sure that we're testing, we're making the proper assessment, we're seeing if you have too much inflammation in the gut, if you have pathogenic organisms in the gut, if you have insufficiencies in digestive enzymes or insufficiencies in hydrochloric acid. So there is a test that looks at all of this, and it's a test that can be done at home, just requires a stool sample. And it really gives us a lot of information, and it gives us a starting point on how to address people with gut dysbiosis and problems with their microbiome. So very, very helpful. I use it all the time with my patients, and this is the restoration program that I use with them. And in addition to the 4 restoration programs, there are other nutrients that help the gut in general and help nourish the gut, such as vitamin A, vitamin C, vitamin B complex, probiotics. Probiotics are a safe supplement to use as long as people don't have immune system problems and they're in good health. They're very, very popular. They help a lot of people. I've used several types of probiotics in my life, and they've been a game changer for me, incredibly helpful. And I recommend probiotics to anyone that's a good candidate for probiotics. And also L-glutamine, as I was mentioning earlier, that amino acid that nourishes the gut lining, and acetylcysteine, which is an antioxidant that becomes glutathione in the body, and EPA and DHA, which are omega fatty acids, which are more commonly known as fish oils. Zinc, which is a strong protector of our immune system. It fortifies our immune system. And knowing that our gut is surrounded by all of this immune tissue, zinc really is helpful as a nutrient for our gut. And then other natural extracts such as cacao, fish oils, as I mentioned, turmeric, zeaxanthin, and resveratrol, both flavonoids and antioxidants, very helpful to help nourish and repair our gut. And then oftentimes people ask me, well, I'm doing the nutrients, I'm doing the program. How about my diet? Well, diet is one of my favorite topics. Food in general, and the way people eat, and how we nourish our bodies, how we nourish our gut. I can't emphasize enough how important that is. So I want to start with foods that regenerate your body, regenerate your cells, help you create more stem cells so that those stem cells go to the damaged areas in your body, such as your heart, your brain, your liver, your kidneys, your muscles, your joints. So the more stem cells your body can make, the healthier you'll be, the less injuries, the less damaged tissue you will have, especially if you're fighting a chronic illness like diabetes, or if you've had a stroke or heart disease, a heart attack. Being able to generate your own stem cells with food can be life-changing. So I'll just touch upon a few. Green beans, incredibly helpful to regenerate stem cells. Goji berries, cranberries, grapes, pistachios, plums, and many more. Very important. And then prebiotic foods. Prebiotics are those substrates that are rich and dense in fiber, and certainly foods such as cherries, kiwis, apricots, lentils, extra virgin olive oil, pomegranate juice, and walnuts. They're full of those important fibers that are used by the bacteria, that are broken down by the bacteria, and then metabolized to short-chain fatty acids that later enter our body and help reduce our levels of inflammation and cholesterol and plaque formation. So very important as prebiotic foods. And then probiotic foods, foods that contain actual bacteria, beneficial bacteria, such as Parmesan cheese, Camembert cheese, Gouda cheese, yogurt, sourdough, sauerkraut. These are all foods that contain very important probiotics. So if you're in the grocery store, if you're trying to select between cheese, different cheeses in the cheese aisle, or breads, it's important to be mindful of the ones that will actually help your gut and actually taste good, right? So why not select these? Now that you're hearing about their wonderful health benefits, you're equipped with the right information to make the right selection. And so, repair food for gut health. You really want to emphasize. I want to emphasize that you want to select foods that are rich in flavonoids and fibers, carotenoids, and lycopenes. All of these will help your stem cells. They'll help your stem cells formation and distribution throughout the body. They'll be driven to areas where damage tissue needs attention, needs restoration, needs transformation. So you want to really select foods that are rich in those four components. And they'll help your muscles grow. They'll help you maintain vitality and vigor, and repair and regenerate damaged tissues. Actually help slow the aging process significantly. So be mindful of that. Eating is one of those things that we do constantly throughout the day, and we're at home more often now. So we have more access to time and to reaching into the pantry, reaching into our refrigerators and grabbing food. So be mindful of what you're eating, and make a selection that will really benefit your microbiome, because it's so important. And if you want to continue this conversation on food, I welcome you to join me and invite you to join me. Reach out to us. We can do a one-on-one consultation and evaluation, complimentary at the moment, for anyone that's watching. Reach out to us, set up a call with us, and I'd love to walk you through all this important information, get you tested, be able to put you through the 4R restoration program, and get you feeling better. Because that's the point of all of this, is really to get you to a place where you're feeling like your health is optimized. You're feeling like you've restored. You've built your immunity. You've built your gut health. You're in a better place physically. Your fitness is much better. You no longer have high cholesterol. You no longer have high blood pressure. And really, that's the reason why I do this, is to help people get off of prescription medication, and just be free and have more healthy options, live a longer life, have longevity. And I want to make sure everyone that's listening, if you want to continue this conversation about gut health and nutrients and how to restore your body, really reach out to us. And if you've had a heart attack, you've had a stroke, your own stem cells can help save your heart. They can help rebuild and improve your fitness. You just have to give your body what the things, the food, the nutrients that it needs in order to make more stem cells. So again, I'm Dr. Alonso Martin with NuLife Institute. My office is at the Carillon Wellness Resort in Miami. So I invite you to come see me, reach out to us. I'd love to meet you in person. And thank you for joining us here on this virtual wellness experience. And just to end things, I want to make sure we're all connected as a community here in South Florida. The Carillon and us, we've partnered with Feeding South Florida, an organization that has been caring for the needs of people in the hospitality industry, people that are not working at the moment and have are having a hard time putting food on their tables and having a hard time economically. So we have partnered with this organization, and we're taking donations. If you'd like to join in this effort, I welcome you. I invite you to get active and help our community. There's some information on this slide, so reach out to us. I want to thank you, everyone that's watching from wherever you're watching in the world. I love that you joined us today. And remember, this is just one series, one virtual experience out of many Carillon conversations that will be coming to you in this format on this platform. And again, thank you so much, and look forward to seeing you next time. We're going to open it up now for any questions that people may have. And again, this is a conversation. It's a very casual setting. So if you have any questions, go ahead and submit them. So there was a question that came in regarding histamine intolerance. So histamine it's a molecule that some of our immune systems produce when we're having allergic reactions. Histamine causes our blood vessels to dilate and more blood to accumulate in areas of allergic reactions or injury. So someone is asking about histamine intolerance. There are certain tests that we can look at when it comes to histamine, whether you have high levels of histamine or you have insufficient levels of histamine. And this is all related more to the immunologic response and the allergic response. So there are certain tests that we can use to look at your levels of histamine and see if there's any imbalances or if there's any reactions that are occurring that may be abnormal or dysfunctional. And there's another question that came in asking whether this type of program can be accomplished or can be done remotely. And again, the gut health testing can be done at home, and this can be done remotely. So reach out to us. We have a platform to do that. It's called telemedicine, and we use HIPAA-compliant technology to be able to see patients from their home. A lot of things are going virtual now, including the healthcare system. And so, yes, this type of testing, this type of service can be done remotely from your home, from the comfort and safety of your own home. And we have another question here. This question is related more to IV therapy, asking whether there are any medical conditions that would be contraindicated for vitamin infusions, such as vitamin C or Myers cocktails. There's many people don't get tests. Don't test, just get infusions. Thoughts? Appreciate the info, Dr. Martin. There are certain blood disorders that you want to be careful when it comes to vitamin infusion. If you're interested in vitamin infusion and you're interested in more what these medical conditions are, like thalassemia, sickle cell disease, things that really affect the structure of the red and white blood cells, different blood dyscrasias, Mediterranean, things that affect only the Mediterranean population. So there are certain things that you certainly want to pay attention to when you're getting IV therapy. And so again, I want to make sure everyone understands and remembers that we always want to start with food. We know that food has such powerful properties that can really heal the body. Food as medicine, let thy food be your medicine. Hippocrates said that hundreds of years ago, and he was on the money. He was completely right about that. And now that we're researching food and we're researching the nutrients and the powerful chemicals that food has, we have all that knowledge, we have all that research, all that evidence that Hippocrates was alluding to in his statements. So we've known that for many years. We've known the power of food, how healing it is, and so we always start with looking at someone's lifestyle. We look at the things that they're doing, what they're eating, what they're consuming, and then we look at deficiencies, and we go through the 4-hour restoration program and really take it from there. And again, for everyone that's watching, I invite you to set up a consultation. Reach out to us. We'll be presenting a slide here, and I will also be providing the slides to everyone that's interested in reviewing the slides. And we really hope to make this a part 2, because gut health is such a huge topic. Like I said, it's researched internationally. There's tons of publications, tons of books, and you really can't learn everything in one session. And so this was an introduction for everyone that was listening. And again, reach out to us, and I hope everyone enjoyed it. And thank you for participating. Until next time.